In today's video, we're going to be talking about the SI joint, the sacroiliac joint, which is right here and right here. We're going to review some anatomy, go through a few different assessments that I use, and then talk about some joint mobilization techniques. This can help with lumbar pain, local SI joint pain, as well as improve lumbar range of motion and hip range of motion. This is something I've wanted to cover for a while because in school I felt like it wasn't covered as much, and I hope to just shed some light and hope that you can learn a few things about the SI joint. So taking a look at the SI joint, which is right here and right here, the sacroiliac joint means where the sacrum meets the ilium. So where those two bones meet, it creates a joint on either side. And where there's a joint, there's ligaments as well, because ligaments support the joint and add a lot of structure and stability. So you can't see them here on this model, but in the actual body, there's a bunch of different ligaments around this area. There's the posterior and anterior SI joint ligaments. There's the interosseous SI joint ligament, the sacrotuberous, as well as sacrospinous. So I'll put some images in the video there so you can review. But those ligaments are there to support this joint as much as possible because it holds a lot of pressure, and the center of gravity is thought to be around S2, which is this segment right here. So you have your head, your whole upper body compressing through the spine right onto the sacrum. So that's a lot of pressure, and then everything below as well, from your feet all the way up to your hips. The pressure kind of travels right into the SI joint. So if you're really active, really busy, the SI joint takes a beating and takes a lot of pressure. So it's really important to work on. And because it's so stable, a lot of people think that you can't affect or influence this joint, but I think you can. And I've had a lot of good results with my patients as well. So let's take a look at a few assessments now. It's always important to assess the area, have a feeling, maybe do some special testing to see what your findings are, and they might help confirm your findings. So the first thing we're going to do is palpation. So we're going to start up in the low back first. So you're kind of palpating the iliac crest from the side. And with this, you want to just check and see if one side's higher, one side's more tight feeling, that sort of thing. So when I look from above, the iliac crests seem pretty even, which is great. Then I'll just palpate the lumbar tone, okay? So right away, I feel the left side's a bit tighter, which might not be an issue, but it could lead you to an issue in the SI joint. So we're going to just work our way down. I'm kind of hooking under the PSIS right now, looking at the levels. Not too bad. However, I do feel more tone kind of right below the PSIS on the left side. So it could be an imbalance or compensation or something. So tighter lumbars, tighter SI region here. When you drop off the PSIS, you do hit piriformis deep to the glutes as well. So I'm just taking all this into account when I'm assessing the SI joint. And then I'm going to palpate either side, following the border of the SI all the way down to the coccyx. And you're just seeing what you feel. Again, more tone on the left glute. Right side feels okay. But overall, no big rotations or imbalances or anything. So you don't want to make a big deal about it if one side is tighter, but you want to check in, do your history with your patient and see what they feel too. Like when you're palpating, do they feel more pain on one side? Is it more sensitive? That sort of thing. Which usually it is, depending on what you find. If one side's tighter or whatever you're suspecting, they'll usually say, oh, that's a bit more sore, that sort of thing. So yeah, left side, I would say a little bit. Nothing crazy, all the way down, feels okay. So the next assessment we're gonna do is check the leg length and then bend the knees and see if anything changes and see what the patient feels when we do that. So coming down to the end of the table here, typically it's better to have the patient's feet off the end and check the heels and the medial malleolus for levels. But for now, we can kind of just take a look here quickly. Left heel, yeah, left heel's shorter, and I hope you can see that in the video there, but left side is shorter. So again, it kind of confirms what we found on the left side. Left SI joint, left lumbars were tighter, potentially pulling this leg up on the left side. So then next, what we're going to do is we're just going to instruct the client to let their legs go really loose, and I'm going to take them all the way up And we're going to go as far as we can. And you're kind of looking at the SI joint, seeing how it moves. And then I'm also palpating which side will go further. So the right side goes further. I'm doing the same amount of pressure, but the left isn't going as much. So it might be a rectus femoris issue in the front of the hip, maybe, or it's the SI isn't as mobile, it's a little bit stuck or something. So we want to release the left side a bit more. Again, still short. So the left side needs some work. After you've checked that test, you can also check Eli's test as well, just to see if there's tension in rectus femoris or how the hip's moving, that sort of thing. So we just basically come up to knee flexion all the way up. His hip doesn't change too much, so I'm not concerned about hip flexors or rectus femoris as much as I am the SI joint, and just check both sides. And again, this is Eli's test, very simple, easy to do in this prone position. Nothing crazy. You're not seeing the whole hip elevate or shift. So not too worried about that one. While you're in this position as well, you can check the piriformis length test if you're concerned about a piriformis tightness or piriformis syndrome issue, if they're having nerve pain down the leg. And you kind of just allow them to internally rotate the hip. You can check both sides. Pretty even. And again, what I'm feeling, just minor little details, is the left side feels a bit more restricted. So it could be piriformis, could be the deep hip external rotators, the deep six there as well. So we want to check all those things. That's looking okay. So far, everything is left-sided. So next, I'm going to do a active glute extension just to see how their SI joint's moving and how their glutes firing. So what you want to do is kind of in this area of the table, you get your patient to keep the knee straight and extend this leg up off the table. So can I have you do that, Toscany? Just come up. How does that feel?
Yeah, it's compressing.
Compressing.
Yeah.
He's feeling tension on the left. Same thing on the right. How does it feel?
It's not as much in the back, but just like my hamstrings there.
Hamstring's a bit tight,
Yeah.
but nothing in the back. Go on the left one more time. And you can kind of see it's a bit more restricted, a little bit more difficult, but check in with them because they'll tell you what they're feeling and how if it feels tight or stiff or achy. All right, so now that we know that the left side seems to be more restricted or tight, we want to add some mobility to that SI joint. And so the first way we're going to do it is very simple. We're just going to palpate here, find the PSIS, and just go, honestly, we're kind of going right on the PSIS and maybe a little bit inferior. So for this, I'm just going to take my pisiform, kind of that portion of the hand, and I'm going to place it as close and basically on the SI joint as possible, right here. And I'm just going to use my other hand for support. And the mobilization is laterally and anteriorly. So we're adding a pretty deep mobilization to that spot. And I'm on my tiptoes right now trying to get leverage here, but I'm basically just leaning my whole body weight into that joint. And like I said earlier, it's a super strong joint, so many ligaments to it, so you can lean into it as long as the patient doesn't have any previous history of injury or anything in this area, osteoporosis, those sort of things. But if they're healthy, then you can really lean and mobilize that. And so I'm making minor little shifts downward inferiorly and applying the same pressure laterally and anteriorly. And you're just going to work the whole SI joint and sacrum. So I'm following the the lateral kind of border of the sacrum here and making minor shifts down and pushing out. This shouldn't be painful. It should be more relieving to the patient, especially if they have a lot of tension here that's been there for years. It should feel good, like a release. Again, moving down a little bit. Nice. Yeah, Toscany's breathing really well. Just get them to breathe. And I'm going to work down a little bit more. Same thing. Pushing out. Awesome. I'm going to go back to the starting position right around the PSIS, a little bit inferior. And again, pushing out. Think about it like you're trying to gap the ilium away from the sacrum. You're trying to just push it away. Good. Work my way down. Okay, just checking PSIS. Tone is softening up a little bit more. I'm going to go a little bit more again. All right, by now it should be feeling a lot more loose, a lot more mobile, more springy in that area, because you're just gapping that, opening that up a little bit more. So that's the first technique. Very simple, just sustained pressure laterally and anteriorly, opening up that SI joint. The next one we're going to do is similar. However, we are going to bend the knee. So we're going to take the knee into about 90 degrees flexion, and we're going to use the leg as a lever. Okay, so we're going to externally rotate this way and internally rotate this way as we mobilize that SI joint. So same thing. I'm going to use my left hand now, and I'm going to find that PSIS, and I'm gapping outwards again, and then I'm going to do kind of a counter pressure at the SI. So external rotation of the hip this way as you hold and gap that SI. And again, I'm going to work downwards along the border of the sacrum there. Same thing. And you're just feeling for any micro changes, feeling for that to soften up. Same thing, working down, external rotation. Good. How are you feeling?
Great.
Yeah, we're getting a nice release here. Now that we've worked with external rotation of the hip, we're going to do the opposite. We're going to do internal rotation of the hip, and this is stretching those deep six hip external rotators. So when those muscles shorten, they do external rotation. When you go internal rotation, they'll lengthen and stretch, especially piriformis and the gemelli and the obturators and quadratus femoris. All of those will kind of stretch when you go into this position. So we can kind of do a passive stretch. What I'm going to do is place my hand on the opposite SI joint about here, and I'm going to stretch out this way. This is just a passive, sustained stretch. I'm using my shoulder, my body weight to pull out this way. Good. You can change your grip this way, which is actually a bit easier. So pin and work this way. You always want to do what's easier on your body as a therapist. And again, I'm going to work my way down a bit and internally rotate, stretch piriformis and the deep hip muscles there. Good. And now same thing, except I'm going to come back to the left SI joint, pin it this way and stretch again. Just open that up as much as possible. Before I move on, I want to touch on a few things about that last position that we did. When you're in this position, I know we're going through joint mobilizations right now, but you can do a lot of soft tissue work as well, especially on piriformis, the glutes. Glute medius is a big one too. So when you're kind of at neutral, you can use your elbow to sink just below PSIS onto the piriformis origin, and then internally rotate the hip and stretch it out. This is more of like a pin and stretch type technique. So you do want to do your soft tissue work, but for this video, I kind of want to highlight the joint mobilizations. But work on piriformis, work on glute medius this way, stretching out. Good. Do your low back work. You can work into the lumbar muscles, iliac crest. There's so much around there that you need to loosen up with soft tissue work first before you even do the joint mobilizations. But we can get into that in another video. So the last one we're going to do is a sacral float, it's called. So basically, the palm of your hand is going to sit right on the top of the sacrum, somewhere here. maybe a little lower. I'm just kind of feeling right there. So your hand's on top of the sacrum, and the pressure is downward into, you're trying to take the sacrum into counter nutation, not nutation. So you're kind of pushing down and making the sacrum shift like this, essentially. So this actually takes, it seems easy, but it takes a lot of practice, because you want to let your hand be as like soft and smooth as possible. If you're really rigid, I feel like it just doesn't work as well. But if you can kind of get set up, keep your hand loose and relaxed. I'll use like my forearm to give me a bit of pressure, or my other hand. You can also do it this way as well, but I'm going to do it this way. So keep your hand loose, relaxed, feel the sacrum, see if there's any imbalances, see if anything feels off. And then I'm just going to use my forearm to give me a bit more pressure into counter nutation, essentially. And it's kind of just decompressing. And you hold here and you just let your hand relax and see if you feel any minor shifts or changes. Sometimes you'll feel like just the muscles relax and the joint move a little bit. Just take your time, and as you feel things kind of open up or shift, then you can add a bit more pressure. So I'm leaning into my hand with my forearm there, and I'm trying to keep my hand as relaxed as possible to just feel any little shift. This takes a lot of practice. You're probably not going to feel much the first bunch of times that you do it, but just go slow, really just like palpate the sacrum and see what you feel. But the key to it is just keeping that hand nice and relaxed. Once you feel things shift or move or soften, or if you don't, even if you don't feel anything, that's okay. And then you just want to slowly come off. And then let's just come back and check the leg length. So we'll come together. Good. It's a lot better. Get a picture of that? Yeah, it's almost, it's basically even just from releasing the SI joint, just from kind of working that. It's improved a lot. It's not always an SI joint problem when you have a leg length discrepancy. Sometimes it could be something cervical or from the neck. It's just a puzzle. You got to figure it out, and sometimes it's really difficult. But for Toscany, it's more SI joint related. That's pulling that leg up. So we address that. Again, if this was treatment, I would definitely work into piriformis a bit more, glutes a bit more, to see if we could fine tune that a little bit more. I'll show you one more really good SI joint release technique that targets glutes, piriformis, and the sacrotuberous ligament. What you want to do is find the PSIS again, somewhere in there, and you're going to go just below it, and you want to find the border of the sacrum, that triangle bone. So here is where the first move is going to be. So you want to take skin slack up, press in, and release inferiorly, right about there. And you'll feel the whole glute twitch and release. And that's only one move. You can do the next move slightly below, still on the border of the sacrum, and move inferiorly. Another one. And last one, a little bit below. I'm really leaning into this with my thumbs. There. Good. How did that feel?
Oh,
Yeah.
it's like a release.
Yeah, it's a nice release to the lateral sacrum, lateral border. Thanks for watching. That's my approach to treating the SI joint here today. I really hope you learned something. Please feel free to like and subscribe. Leave a comment down below if you have a different approach to treating this, and it'd be great to hear from you. I hope this helped you, and we'll see you on the next one.